and we all have class at 1 too. I'm gonna probably move kind of fast, so if there's a certain part you want me to slow down, I'm more than happy to. Just raise your hand, feel free to ask questions. A lot of the questions that were asked on the survey I've incorporated into the slides too, so hopefully we can get some of those answered. Thank you all so much for coming. I know Wednesdays are really long days for us, and this week has been kind of crazy. So I really appreciate you guys all taking the time out of your schedule to come. So LGBTQA inclusive healthcare. A lot of LGBT people have trouble finding healthcare where they feel included and accepted. Negative encounters with any staff member, frontline. I've heard panel discussions about the receptionist checking people in, people checking their vitals, the doctor, a tech in the lab. Any negative encounter like that can really affect a person's perception and comfort getting healthcare in general. Some queer people have been reported being refused care because of how they identify. Others say they've overheard jokes or slurs or people talking about other patients or even like their family members. In a lot of cases, it's just simple oversights that they internalize. So it might not even be somebody, saying to their face something rude. It can just be something they heard a nurse say in an elevator or something. So for people who have experienced this kind of stigma and discrimination in their lives, even those small mistakes can bring up bad past experiences. So they kind of just build up on top of each other. And unless we communicate with knowledge and understanding about their health concerns, the barriers that they face in their care, and other needs that they have in the LGBT community, they might not ever get the services that they need. So that's why I am so passionate about it. So this is kind of the roadmap that I'm going to be going down. Part 1 is talking about background info on LGBT people, common terms, their health needs. Part 2 is tips and strategies for us as practitioners to improve communication and create an affirming and inclusive environment. And then part 3 is a lot of helpful resources. I don't think I ended up putting the glossary in there, I'll have to do that later, and additional info. So creating an affirming and inclusive environment for LGBT people requires a combination of understanding the population as a whole and also understanding the individual. Finding this balance can seem really complicated at first, but we know it's no different than any of the procedures we do with any other patient. You just have to go a little bit of that extra mile. Effectively serving our LGBT patients requires us to understand the cultural context of their lives, modifying our procedures, our behavior, and our language to be inclusive, non-judgmental, and helpful. By taking these steps, healthcare staff can help ensure that their LGBT patients receive the care that they deserve. So part 1, concepts and terms, common health concerns, and barriers to healthcare. Okay, sexual orientation tells you how a person characterizes their sexual and emotional attraction to others. These boxes, the pink boxes, are questions that I got in the survey. So how is queer different? When is it appropriate to use? I identify as queer. I'm more than happy if somebody's like, hey, this is my queer friend Ashleigh. Not everybody is like that, so I wouldn't go out if you know that somebody is gay or bisexual or lesbian. I wouldn't necessarily, especially if they're an older generation. A lot of older generation takes that as an offense. But our generation has kind of tried to reclaim it, so it really depends on how they identify and how they tell you. And that can change. So being open and talking to your patients and your clients, like, has anything changed since the last time we talked? And just leaving it really open-ended, and like, yeah, actually, no. I've been thinking about my pronouns and I really want to use he, him. As opposed to, I don't know, something like specific and making them feel on the spot. Just kind of opening that open-ended and letting them choose to tell you if you've built that rapport and they feel comfortable sharing that with you. Heterosexual, straight. Gay sexual orientation describes a person who's emotionally and sexually attracted to people of their own gender. It's more commonly used to describe men. Lesbian is a sexual orientation that describes a woman who's emotionally and sexually attracted to other women. Bisexual is a person who is emotional and sexually attracted to people of their own gender and people of other genders. So this definition has changed recently because with the idea of people who are gender nonconforming or non-binary, I love the term bisexual. It's a term I grew up using, and I don't want to, it's a part of who I am, but I don't want to ostracize other people by saying, well, there's two genders, bi means two, boys and girls. So we've changed the definition to mean I'm attracted to people of my own gender and other genders. So we can kind of keep a history of bisexuality while also including other people. And then queer is an umbrella term for sexual and gender minorities who are not heterosexual or cisgender. A lot of people who identify as LGBT identify as queer too. Yeah.
So how do you remain sensitive to the ideas of, different sexualities if you know or are in contact with their support members or family or spouse, and it's different from what their answer is? Because I think my assumption is going to be oh, if you have your lesbian partner there, I'm going to think you're a lesbian because I'm seeing visually two women, but not assuming that they're not bisexual.
Yeah.
I think I'm going to visually take in something and route myself appropriately.
Yeah.
But I don't know how to be sensitive to that bisexual category because I'm not as familiar with how to just be cognizant of it.
Yeah. I mean, I think half of that is addressing your own bias, so it's great that you recognize it and just being conscious of that. Another thing is not assuming that people they come with are their partners. Even with straight people, I've had clinicians tell me oh, I assume oh, hey, your daughter's here for you with her knee surgery. It's no, that's my wife. So, so it's biases of any age or gender or sexuality. We kind of have to be careful because that might not be her lesbian partner, or that might not be her only partner. Maybe the woman and the man in the room are her partners. So I think asking about sexuality, if it's relative, or hey, tell me about the people in the room. Do you know these people? Are these strangers? I work with a lot of people who make jokes like that. Should I kick these people out or do you know them? And that's kind of more of a lighthearted way as opposed to calling them out. Then they can tell you what they're comfortable with. And then if that pertains to, what they're working on, if they're seeing you because of their anxiety around managing coming out to people, then that could be a great segue into talking about that and trying to go over that. Does that kind of answer your question?
Yeah.
Cool. Lady?
What is cisgender?
So cisgender, I think I have it on the next.
Oh, okay. Well, carry on.
Maybe I don't. So cisgender is a person who was their heart and their body aligned. So you're assigned a female at birth. You are a female.
Gotcha.
You don't have any issues with that. That's who you are.
Okay. Okay. Thanks.
Yeah. Does anybody else have any questions about sexuality before we move on to gender? Cool. So gender identity is a person's internal sense of being male or female, both, neither, or another gender. The world of gender identity is really exploding right now. There's a lot of research coming out. A lot of people are finding new terms and new vocabulary to describe themselves in ways that people didn't have before. So it's very interesting, very heartwarming, really cool. So most people have gender identity that's the same sex that they were assigned at birth, cisgender. But some people have a gender identity that does not correspond to the sex they were assigned. We use the term transgender or trans to describe these individuals. A trans man, so this is a kind of an obstacle that I see people struggle through when they're talking about trans people. They're well, I know they're trans, but I don't know how, trans man, trans woman who was a man. So the way I think about it is who they are is the term that you should be using. They are a man. So if you're talking about the fact that they're trans, you would say the trans man. If for some reason you needed to say it like that. So a trans man is someone who is assigned female at birth but identifies as a man. A trans woman is the opposite. They were assigned male at birth and they identify as a woman. Other people have gender identities that fall outside of the traditional gender binary. So kind of like when I was talking about bisexual, trying to be more incorporating all genders. Some people use the term genderqueer or gender fluid. This is just really blowing up right now with vocabulary and support groups and people trying to kind of navigate this gray area in between. Another thing that I see is you want to keep in mind that trans people can have any sexual orientation. So just because they're trans doesn't mean that they're queer or that they identify as queer or gay. Yeah?
You continue.
Oh.
I just have a question when you're finished with that part.
So this is the same idea of if you're trying to verbalize it, if this person identifies as a man and they're dating a woman or they only date women, they're straight. I mean, they can identify however they want. A lot of people, their gender identity brings that sense of queerness, that sense of community with other LGBT people. So even though they might exclusively date women, they might consider themselves queer. It's really individual. But you really wouldn't want to call a trans man a lesbian if he dated women because he's not a woman. Yes.
Can you, something you taught me that I didn't know was the use of transgendered.
Yeah, that's coming up too.
Okay.
Yeah.
I think it's important.
Actually, Ashleigh,
Yeah.
so you said another gender, besides being
Male or female?
male or female or both,
Mm-hmm.
is there something outside of that?
There's neither.
Okay.
There's, I mean, that's kind of the whole
Okay.
expanse.
I
It's
just
like-
want to make sure it didn't get past that.
Yeah, I mean, I don't want to say no,
Okay.
but I feel like, because there's also, well, like Two-Spirit is both, that the native, like, way, and the other cultures have them too. There's intersex as well, which is not necessarily a gender identity so much as, I don't know how to describe it right, but a person who is born with more than one set of sexual organs or ambiguous genitalia. So that comes up too because they also face barriers to healthcare, which I'll cover a little bit too. Yeah.
Ash,
Yeah. Hi.
can you explain, is there a difference between genderqueer and gender fluid? Should you only bring that up when the person brings it up? Like, what's the difference between those?
I think they are different. And I think gender queer and gender fluid is really individual. And I find that I think people who use those identities tend to be pretty proud. I would say proud of them, like, I don't know, like I am, I guess. I'm not gender queer, but I think they would be, it's not a term that I would come out and like accidentally call somebody.
Mhm.
It would be something that they would tell me, this is how I identify, if that makes sense.
Yes.
But I'll have to Google the exact difference because I don't know. Yeah.
Just to shed a little light, I've heard some people refer to themselves as gender fluid when they feel like some parts of the day maybe they feel like a man, some parts of the day maybe they feel like a woman or
Yeah.
otherwise, and so it's more of a constant change.
Yeah.
Again, I'm not sure if that's like the dictionary definition,
Yeah.
but I've heard people describe themselves that way.
I've heard it that way too, in chat, was what I was gonna say, and then just about the question about being neither, I feel like envy is really common right
Yeah.
now, that's ENVY, and that stands for non-binary, and I feel people who identify as both or neither kind of embrace that as
Yeah.
well.
Yeah. Okay, so barriers. Maybe. There we go. Limited access. So kind of how I was mentioning earlier, a lot of queer people are under or uninsured maybe they've been rejected by families if they're youth, they don't have their parents' insurance anymore. Maybe they're unemployed or they've fallen into homelessness, so then they don't have access to health care. Or they require services that are not covered under their insurance. We'll go over that a little bit. Negative experiences, huge reason LGBT people do not seek out the care that they need is because of poorly trained professionals, and really simple things like positive greetings, gender-neutral bathrooms, welcoming signs, the pins that you guys all bought. It's an awesome sign for people because we look for that stuff when we go to the doctor. Yeah, like UC Health just did new campaigns and they have like queer families, and I'm just like, oh, look. So it really takes a little bit of pressure off when you go to the doctor. And then lack of knowledge. A lot of healthcare providers just don't know what LGBTQIA patients need. Yeah.
Do you think, in general, it's better to like advocate to like say your employers, like UC Health, to kind of do these more like systemic signals that you support LGBTQ people versus like personally talking to a client and be like that's the thing. I don't know how you would address this with a person on an individual basis, but basically, I don't know how you would signal like, just so you know, like if you are LGBTQ, I am here to support you.
Cool. It's cool.
Exactly. Like, yeah. So I don't know if that's like ever something you personally want to like try to.
I think it's both. It comes from top down and it can come directly from you. So I think systematic changes and visibility is great, but I also think having a pin on your lanyard or saying, you know, who is this in your room, as opposed to assuming they are. Or like my primary care practitioner didn't ask about my sexuality at all, and bisexual women have huge like rates of anxiety and depression and other mental health issues. So I feel like if my doctors had ever tried to ask me about my sexuality, just knowing that statistic, be like, let's talk about mental health. How are you doing? Do you have any concerns? So if you do find a way where they're like, oh, this is my partner, or even asking all of your patients, some people make it a habit to say, you know, there's a preferred name in the chart, you know, what's your name, what are your pronouns, so I can put it in here. And I mean, the worst that's going to happen is somebody's going to be like, why do you need to know my pronouns? Well, I want to provide inclusive care for all of my patients. I ask this of everybody.
Okay, I like
So, yeah. So.
Yeah, I would, just bouncing off of Chad's question, if any of you use the Student Health Network on campus, I'd challenge you to keep an eye out for anything LGBTQIA related as you're in there, because I noticed when I was sitting in there that there were lanyards, there were pins, there were things on their stands, and immediately I felt super welcome, and they used more neutral terms like partner if they're going to ask about things like that, and all of those little things I would pick up on immediately and think, oh, this is an inviting, safe place. And it can be that simple. And there are a lot at our network, which is really cool.
Yeah. Okay. I forgot. So the little pink boxes are questions that were asked in the survey, and then this blue box in the upper left-hand corner is particular or especially important with trans health. So barriers to healthcare for trans people. I did a whole presentation on this for UC Health, so I tried to condense it. Really, they're facing a lot of social and economic marginalization, a lot more homelessness, a lot more social isolation from their families, higher levels of poverty, much more differential access. They're more likely to be on public health care. They're more likely to get denied coverage related to gender affirmation or even just routine care. Big fear of discrimination, very serious fear of discrimination. Limited availability of appropriate and competent care. Discrimination, inappropriate questions, or just unfamiliar with trans health. This is one of the questions that was on a national survey. And one thing that really stood out to me, I think it's the next one. It's the next one. But this is just some of the issues that trans people face with specific to medical care. I have it written in my notes, that's why. So, trans people have a much higher chance of being fired due to their gender identity. over 30% of respondents in the survey experienced some form of mistreatment in the workplace. Almost half of the respondents were verbally harassed, 9% were physically attacked, and 10% were sexually assaulted in the past year, just specific to their gender identity. Almost 50% have been sexually assaulted at some point in their life. Their unemployment rate is 3 times higher than the unemployment rate in the US population. Poverty rate is twice as high. And it won't let me see my notes on differential access. But there we go. Fear of discrimination. 1/3 of the respondents who saw a healthcare provider had at least one negative experience related to being trans. 23% did not see a doctor when they needed to because of fear of being mistreated. So on top of like the regular anxiety that you have making a doctor's appointment, figuring out how you're going to get there, how it fits into your schedule, now you have added on to you, are they going to verbally harass me, sexually assault me, physically attack me? It has happened. And this last one is really important. Inappropriate questions, I mean, we're a curious species, but really just understanding that if it doesn't have anything to do with the care you're giving them, you don't need to ask about it. Especially if it's related to their body. You don't need to know about the private parts. You just really don't. But you'd be surprised. A lot of people have gotten like, and so you're a trans person and you're already afraid to be in the doctor's office, and then suddenly your doctor is saying that they need to give you a pelvic exam, and you're like, well, shit, you're the one that's in charge, so I guess I'll give you a pelvic exam, and then it has nothing to do with why you're there. It's just their curiosity. So obviously that's a very extreme example, but they are asked inappropriate questions related to their gender identity all the time. So we'll go over like what inappropriate questions are as I hurry up and get through part 1. So this statistic, I was just reading this survey one day like a year and a half ago, and this statistic is what made me want to do my presentation. 28% of people in the survey had been verbally harassed by medical professionals. 2% had been physically assaulted by medical professionals. And I did the math. 1,792 people were verbally harassed, and 128 people were physically assaulted. Those are real human beings. And that was in 2011. 2015, it was a little bit lower, but it was still a large number of people that kind of grouped together verbal and physical harassment. But I just think that's insane. So that's my motivation for this. How much does my provider know about trans health? Not sure. It's mostly negative. Not sure, some things, almost nothing. I mean, it's hard to know almost everything, but just giving the attitude that you want to know, that you're learning, you know, apologizing for making mistakes, moving on, researching it better for next time, being like, hey, I did some reading, I think I have a better understanding of this, and just showing that you're competent and you're trying. Okay. So, the impact of all of these barriers to care: minority stress. Being a member of a group that experiences discrimination leads to very high levels of stress, unhealthy coping behaviors, and health issues related to stigma and discrimination. LGBT people are more likely to smoke, drink, and use drugs to deal with the stigma and discrimination. They have higher rates of depression, anxiety, and behavioral disorders. LGBT youth are 2 to 3 times more likely to attempt suicide, and 20 to 40% of our homeless youth throughout the nation are LGBT. There are some studies that show that there are higher rates of cancer because we're less likely to get screenings. That goes for people with of sexual minority and gender minority. Something that I didn't really think about until I started doing this research is that trans people aren't likely to get recruited for their regular screenings because they're gender identity is different. But they still have the same plumbing. They still need to get checked out, but they also have this dysphoria with their body parts, this fear of being touched by people, of being discriminated against. So they go without the care and the screenings that they need and have higher rates of cervical and prostate cancer because of it, and breast cancer. And then our elderly community, discrimination and stigma is very common in elderly housing. So our elders are isolated, they don't have as much family support, and they have limited resources. I know I'm bumming you guys all out. Impact on trans health. This is another statistic that really made me dive into this. Over 40% of trans people have attempted suicide in their lifetime. That is a really stupid statistic, and it's really sad. Trans people have much higher rates of psychological distress. This suicide rate, or attempted suicide rate, is 9 times higher than the rest of the population. Higher rates of smoking, drug use, alcohol abuse to cope with living in our transphobic society. Higher rates of HIV, lower likelihood of cancer screenings. Woo, what can I do? So it may not seem like you can do much. Yeah,
Real quick, can you go over the acronym? Just the I
Yeah.
and the A, those are new to me.
yeah. So LGBT, you know those ones. I is intersex.
Okay,
A is asexual, asexuality.
okay.
Q can also be questioning,
Oh,
queer and questioning.
okay.
A can also, I want to say agender? Yeah. I think A can stand for a couple things too.
Okay.
Yeah, it's evolving. We love our alphabets. So it may not seem like you can do much, but just being here is doing a lot, and being open and trying to change your language, trying to curb your curiosity, you know, it's a lot. Accept that mistakes will be made, but do your best to avoid them. Do your best to be a provider that the patient doesn't have to teach. Because that is really, I mean, it makes you lose your, what's the word I'm thinking of? Credibility. And it makes them feel crappy and like nobody knows how to take care of them, or at least you don't. So, yeah. What else? Creating an affirming and inclusive environment. One of the questions in the survey, how do I bring up asking an individual about their pronouns? Is that ever inappropriate? No. I mean, unless you're like, if you can definitely ask it in an inappropriate way, where you're like, was he, she, I can't remember. These kids these days are always changing their pronouns, they, them, what's that? Like, definitely don't ever do it like that because it just feels awful. But what are your personal pronouns? In the past few years, people were asking what are your preferred pronouns, but that actually makes it sound like they're making a choice or like they're always going to change their minds. So what are your personal pronouns? How would you like to be addressed? It feels awkward for us because we're not used to doing it, but it really will help affirm this person who's in your care. Yeah.
I just want to add something. I work at the CSU Health Network, and so something we're all trying to do is adding our pronouns to our email signature. So
Yeah.
if you all haven't done that, that would be an awesome way to
Yes.
set a standard.
Yeah. I did that at UC Health too on my signature, and I got an email back. Like I sent out a mass email, something dumb, to like 300 people, and somebody immediately replied like, I love this, thank you so much for doing this. And it's like, and then there are people who don't respond to your email who are like, man, that's cool. So yeah, that's a good one to do. Yeah.
Well, just like when you're entering a patient's room or someone's room, sharing your pronouns, but I've also heard that like asking pronouns can feel really invasive, so at least sharing yours so someone feels comfortable.
Yeah.
And then also like if they don't share their pronouns and you're not sure what they are, you can always just insert their name
Yeah.
instead. So.
Yeah. And or use like they, them, if you're not sure. Don't assume. I was going to say something on top of that. What did you say first?
Just sharing your own.
Oh, yeah.
Because asking can feel invasive.
At our graduate dinner, when the president introduced himself, he was like, "My name is so-and-so, I use he, him pronouns." And the whole time he was talking, I was like, "Oh my God, this is amazing." I immediately emailed him, and I was like, "Thank you so much for doing this." And then I like stopped him on his way out, and he's like, "I just saw your email, are you the one?" And I was like, "Yes, thank you." It was just because obviously his presentation wasn't anything about gender identity. He just was in a room full of hundreds of people and wanted them to know, like, this is cool. Yeah.
Well, I just also wanted to mention that I noticed some languages that have feminine or masculine
Yeah.
to their language component are now using like X
Uh-huh.
instead of A or O.
Uh-huh.
It's
Yeah.
so just
Yeah,
feel-
language is like changing a lot too, like our language obviously, but also, yeah, the Spanish language and I'm sure other ones.
So we get out of other we already canceled.
Oh, really?
School's closing at
Okay, tip number 2, create and enforce an inclusive environment. Don't be afraid to politely correct people. If they use the wrong names and pronouns or if they make insensitive comments, even if nobody is there that you're worried about overhearing, if they make a comment in the lunchroom or something, don't be afraid to be, it's like, you're not gonna, I don't know, I always err on the side of like being a good person, of like, well, you know, I'm embarrassed to call you out, but like, don't say that's so gay, it's not good. Actually, I wouldn't be embarrassed to say that because I call people out all the time. Challenge anti-LGBT jokes or comments made in public places, support all gender restrooms. One of the questions was how to deal with coworkers that aren't supportive of LGBT+. All I can really say to that is just trying to, it sucks because sometimes you have to take the moral high ground and just be a better person and be an example. Other times you balance that out with calling them out, hey, you're making me really uncomfortable, I don't know if you know, but I identify as bisexual or queer, or, you know, I just don't think that's cool, even if I'm straight, whatever. Yeah. Tip number 3, be competent. Research how their gender identity or sexuality might affect their treatment, if it does at all. If you're seeing, yeah?
Where would you recommend going for like looking things up, like Google Scholar, or what's the best place?
There's a couple of resources, and there's a lot of really good like webinars on an LGBT health website that I'll put up.
Okay.
Yeah.
Okay.
Oh, I was going to say, if you are seeing, oh, it's snowing, a trans man after he's had parts of his chest removed, you might be working with them on scar tissue or range of motion in their arms. So that is a time when their gender identity would specifically affect their treatment with us in OT. So that's just one situation. I mean, trans people, they're human too, so you might be seeing them for nothing related to their gender identity. But touching their body might be an issue. So just having that open conversation and being receptive to how they want to be touched, how they want to be addressed, what they want you to call their body parts. We'll go over that a little bit too. Asking to clarify as opposed to asking without any information at all. So even if you've tried and you're like, this is all I could find on this, does this sound right? Does this sound like it fits you? Does this sound like it would be comfortable? And having it be more of a dialogue and collaboration as opposed to you just asking, okay, so what do you want me to do? Because they're not going to know. And take advantage of the direct access you have to the patient right now. Screen for things that you are able to, or help check in about primary care. I know that healthcare is stressful. You know, maybe you have talked about it with them before, but I just want to make sure you're getting the right primary care. There's a list that I have in the resources here, specific to Northern Colorado. It's like 70 pages long that they've been working on from the Pride Resource Center. And in one of the, it has everything from like friendly lawyers, it's like an encyclopedia. But one of the pages is about medical providers here in the area. So that's cool to know. Step number 4, move on. We all make mistakes. Don't ruminate on it. Don't start telling them about a trans friend you had in high school. who you really support and you love their family, you see their pictures on Facebook all the time, it's great, you love trans people. Just don't do it. It just makes people uncomfortable. Just apologize. I'm sorry, I really didn't mean to disrespect you. I apologize for using the wrong pronoun. Call yourself out. Also, don't act like it didn't happen, because that just makes people feel kind of crazy too. So yeah, just say, I'm sorry I used the wrong pronoun. I didn't mean to disrespect you. And move on. Don't rely on cues from family. Family might outright be disrespecting your patient when you know that their pronouns are he, him. You've had conversations about it. Now their mom is in the room and the mom refuses to use he, him pronouns. I know that can be confusing. There's maybe some family education that goes in there, but ultimately it comes down to who your patient is and what they want and being a good person. Tip number 5, don't use dead names or old pronouns. So I see this a lot when people talk about someone they know that's trans, and they talk about them in the past. Oh, my friend Bob is a trans man, but when we were little and he was a little girl, we used to love doing whatever. He was never a girl. He identifies as a man. He was a man. Just say as a child or as a kid. If you have to talk about it, it might not have anything to do with what you're saying. It's rude and it can be dangerous. If you're at a party and you're like, oh yeah, Susan used to date my friend back when she was Bob, and that person didn't know that she was trans, you just outed her. And that can be really dangerous. Like, trans people are dying every day. That can be really dangerous. Yeah. Great. Okay, what not to say and what to say instead. Dead naming is the practice of using someone's old name, maybe the name that they were given at birth. Don't say it. Don't call it their real name. It's not. It is actually seen as a verbally violent offense because it's attempting to invalidate a trans person. So use their name. It might be legally changed, it might not be. There's different transitions. There's medical transition of when someone gets surgeries. There's social transitions of when a person is socially transitioning. So if they tell you, hey, my preferred name is this is my name, use that. This comes up in registration people, front desk people. So I know different systems work differently. UC Health just changed theirs. My sister was a front desk person for them. They used to, all their appointments would be lined up in one side, and they would call people by name, and there wasn't a column for preferred name or nickname. So it would be their legal, and there was this a pediatric clinic, so a lot of their names hadn't been changed yet. But now they've changed it, where preferred name or nickname will override first name. So changes are being made, so if you're in a place where that can be an issue, advocating for that kind of change is awesome, because other people just don't really think about it. So if it's an easy fix, and you're like, hey, can we do this? You know, I'm concerned about our patients and their gender identity and not being, dead naming somebody. Don't say sex change. It inaccurately suggests that a person had surgery or that they have to have surgery in order to transition. Avoid overemphasizing surgery when discussing trans people or the process of transition. And avoid discussing it altogether if it's not relevant to the care you're providing. Super private. If it is relevant to the care you're providing, then use gender confirmation or gender affirmation. These phrases emphasize the treatment, not so much as a transformation, but as an acknowledgement that their mind and body need realignment. Yeah. Don't say transgender or transsexual. This was a question in the comments, which I appreciated. The most common objection to the word transgendered is it sounds past tense, sounds like something happened to them. That there was a distinct before and after. I love this example. You would not say Elton John is gay or Ellen DeGeneres is lesbian. Therefore, you would not say your patient is transgendered. Transsexual is a generational term, no longer preferred by many people. It's often seen as overly clinical, and it's associated with psychological disorders. Don't say transgenders or a transgender like you're at a zoo. Transgender should be used as an adjective, not a noun. Don't say so-and-so is a transgender, or the parade had many transgenders. What to say instead, transgender or trans, a transgender person, transgender people. Tony's a transgender man. The parade included many transgender people. I'm not sure where that example. The pride parade. Don't say biologically male or female, genetically male, born a man, born a woman. It's a really complex subject. A person's sex is determined by a number of things, not just their genetics and not just their biology, and their biology doesn't trump their gender identity. People are born babies, they're not born a man or woman. So you can say assigned male at birth, assigned female. AFAB, AMAP, these are really common abbreviations that you'll see. I see the first two more often, but designated female and male at birth will come up too. We talked about this a little bit earlier. Don't ask what pronouns they prefer. Ask them, what are your personal pronouns? How would you like to be addressed? Please avoid backhanded compliments or helpful tips. Wow, I can't even tell. You look just like a girl. You know, or helpful tips, you could pass better. Let me just help you with your makeup. If you got a better wig, you would look more like a girl. Or have you thought about voice therapy? So this is kind of a gray area where if you develop a relationship with a parent, let them decide when to talk to you about alternative therapies. If they're interested in speech therapy, which is available, or I don't know, PT for gay training or something. Let them be the ones to direct that conversation. Again, just always being the provider that's open for a conversation and affirming of their care. They will come to you if they want that. This is best practice. I think I went over most of these. I like this, like use the terms people use to describe themselves. So if someone says they're gay, don't call them homosexual. They like the term gay. I don't know. Or if a woman refers to her wife, then say your wife when talking about her, not your friend or this person with you. She just told you she's her wife. Yeah. Almost done. Okay, our role in trans health. Holistic care, focusing on the transactional nature of person, environment, occupation. Gender presentation, we can help with teaching gendered tasks that maybe they didn't learn growing up, that they want to be more competent in. Grooming, shaving, skincare, doing makeup, doing laundry, cooking, sexual practices, like there's all kinds of things that are gender that we've learned over time that maybe people need help learning. Work-related occupations, same thing, gendered job skills, changing careers, managing coming out at work, the anxiety that goes around that, educating their employers, social networking, helping them reduce their social isolation, managing stress and anxiety, and self-advocacy, working with schools, employers, unemployment insurance companies for benefits, legal identification, housing, residential services, all kinds of stuff. So that's our scope. Oh yay, resources. So LGBTHealthEducation.org has free webinars and online learning modules and videos and handouts. They have stuff specific for clinical care. They also have stuff for patients. They have stuff for like facilitating difficult conversations. It's great. And then these are some more websites. I like this. I just found this today, transwhat.org. And it's like a glossary, and it's just, the intro is funny. It's like, trans what? You know, like to people who are like, there's so many words now, I don't understand. It's awesome. I love it. This is the resource list I was talking about for Northern Colorado. They have everything. These are the resources that I used for the stats that I found. This big one by the IOM, That was the first report done in 2011, and then they did another report in 2010, or 2015. And there was a good report written in PT Magazine that I didn't put up there either, or PT. Yay! I did it! So, question, yeah.
Could you make this PowerPoint?
Yeah. Yes.
That'd be great.
Yes.
Thank you.
I shared it on the Facebook group that you joined with. Yeah.
I just wanted to comment, like, if any of you are ever working a place and they're like, what's the evidence behind it? I did specifically a brief topic on gender affirmative care, and there's a ton of shit out there, so
Yeah.
if people want numbers of research studies, it's out there, you can find it, you can be like, bitch, look at this.
Yeah.
Isn't another resource, there's a website called It's Pronounced Metrosexual. That's like the website, and there's a ton of like really simple infographics, so if you're really new at this, or you want to like hang something up at work, they have a ton of principles there.
Cool. Thanks, guys.
Thanks, Ashley.
Thanks, everyone. Okay.